Hello, we are here to discuss our project today known as the Multi-Level and Multicultural Intervention to Increase COVID-19 Vaccination Uptake among African American and Latinx public housing residents here in Los Angeles County. I am Dr. Sharon Cobb, and I'm currently an assistant professor as well as the director of pre-licensure nursing programs here at the Mervyn M. Dimley School of Nursing. And I'm joined by my colleague.
Hi, I'm Professor Dillard. I'm also faculty here at the School of Nursing at Charles R. Drew University of Medicine and Science, as well as the project coordinator for this particular grant.
And additionally, we have one of our co-principal investigators, and that's none other than Dr. Mohsen Bazargan, who's also a professor and faculty trustee here at Charles R. Drew University of Medicine and Science. One of the reasons we're here today and one of the reasons that initiated this project was due to the various health disparities surrounding COVID-19, especially here for Los Angeles County and specifically here in South Los Angeles. When we look at how the COVID-19 pandemic has taken an extreme toll among underrepresented groups, especially African Americans and Latinx individuals, we have to ensure what are we doing to play our part, especially being faculty and being a part of our community. When we've looked at the mortality, when we've looked at the infection rates, we've seen that African Americans and Latinx individuals have had higher rates of infection, of death rates, of just overall impact to the communities based on COVID-19, which caused severe concern and which caused a lot of the interventions we have done to put into place to say, what can we do in order to mitigate some of the risks, some of the extreme impact that has been caused by COVID-19 pandemic. Additionally, we also started to turn around and say, let's focus on vaccination. When we look at COVID-19 vaccination, especially among these communities, they still remain lower than other groups, specifically non-Hispanic whites. One of the reasons why, as we've already, which has been alluded to, is also just the deep mistrust that may be among individuals, especially African-American and Latinx individuals. Specifically looking at studies such as the Henrietta Lacks study, as well as the Tuskegee experiment, we know that there are many factors that have led to deep mistrust among these groups. Specifically, one of the groups that we wanted to form more of a collaboration with was those living in public housing communities. Across the United States, there are various communities in regards to public housing, yet they remain one of the most underrepresented and one of the most under-resourced communities within the nation. And many times they are primarily populated by African American and Latinx groups, and still remaining where they have a lot of health disparities. And so for that reason, we wanted to zoom in and see, how do we assess how COVID-19 pandemic has impacted the public housing communities? What do we need to do, and how do we foster collaboration in order to increase not only knowledge, trust, but also access to vaccines as well within this community? And this precipitated what came to be in terms of our aims, what we sought to do in order to bring more light to this issue for the community and foster trust and collaboration.
That being said, we have taken the approach of addressing this issue of COVID-19 vaccine uptake, and specifically low rates of uptake among the African American and Latinx public housing residents by addressing this issue from a three-tier approach. So looking at how we can train public housing residents within the community to be what we call our activate leaders. And these are individuals who are COVID-19 vaccine educators, as well as just people who have enhanced knowledge due to training that we've provided them in a virtual setting. We were actually able to collaborate and make this a community as well as academic collaboration by training activate leaders who are public housing residents within 4 sites of the Housing Authority of the City of LA, as well as training some of our health professional students here at Charles Drew University. specifically our PA students, as well as our Masters of Public Health students. So these are individuals who've been trained, as COVID-19 vaccine educators and experts who will then go and communicate with the community about what they know and try to address some of the factors and barriers that contribute to the lack of uptake, as well as concern that residents rightfully have against the COVID-19 vaccine. So we were able to collaborate and create a 7-session workshop where we trained these individuals. We had about 15 public housing residents who completed training. This started in summer of 2021 and continued all the way to the spring of 2021, as well as our MPH students here at the CDU University and our PA students. So about 19 PA students and about, I would say, 42 MPH students have been trained thus far. And we call this phase 1, making sure they have the knowledge and education on COVID-19 vaccine. And then we are then going to take that information and allow them to be educators to public housing residents. So it was very important that we did this and specifically addressing public housing residents and making sure they had this knowledge to be leaders within their community. So that was phase 1.
Okay. And then moving on from phase 1, as Professor Dillard just noted, having community residents trained as COVID-19 leaders, being that stakeholder, that primary go-to person for the community is so pivotal, because this is the impact where individuals who see these residents on a daily basis now know this is someone who is trusted within the community in order to know they have the COVID-19 access, they have the information, they have been trained. So why not, if I see something on social media, if I have a question, I can just go talk to now a resident who's just been trained. And so just as noted, we formed a triadic approach with this. This means that within this triad, we have the physician assistant / nurse practitioner who's trained in the health assessment of these individuals, who'll be able to provide physical health assessments, being able to hear about health chronic conditions that may be going on. We have our Master of Public Health students who are trained in more of the social and environmental health issues that the individual might be going through, and definitely public awareness. And then that last person of the triad is the public housing resident, who is the go-to, who's the expert in the community. And so with that, we were able to utilize these triads in what became phase 2, which is to now bring the information to the community. And what we actually have done is to be able to actually host town halls. And so with the town halls now, we've actually hosted 4 virtual town halls, and we decided to host it virtual in light of COVID-19 pandemic. And what we decided to have is where we address myths and barriers of COVID-19. We address COVID-19 vaccines for children. We also talked about the long-term impact of COVID, and as well as some of the other social issues around COVID, such as individuals who might be incarcerated and might be re-entry into society. How are they faced with COVID? And so with that, these are some of the pivotal issues that we talked about within our virtual town halls. And each virtual town hall was held in both English and Spanish. So we had experts who were both not only physicians, nurses, social workers, but we had leading experts joined by also community residents who were able to speak on panels, in which now the audience at each town hall could provide their questions to be able to speak and be able to ask any question that they desire to get answers from experts. And these town halls were moderated by our own MPH students. And, you know, we have to acknowledge that these students, both the physician assistant and Masters of Public Health students, the MPH students, are our very own CDU students. So this just brought in that collaboration more in being community oriented and in making sure that we're bringing the knowledge to the community. Furthermore, after each town hall, we wanted to see how are we making sure the information that is provided virtually is being linked to the community. So after each town hall, we actually hosted what is known as a health resource fair. And so after our first town hall that was held in English and Spanish, we actually hosted our very first town hall, very first resource fair at Nickerson Gardens. And this was a huge town hall resource fair in which we had the community come out. Nickerson Gardens is in South LA and in close proximity to our campus. And we were able to provide, in terms of hotspots, we had service partners who provided hotspots. We gave away medical equipment. And most importantly, we wanted to ensure that COVID-19 testing and vaccination was at each health resource fair. Our second health resource fair took place at Imperial Courts, specifically in front of the Watts Empowerment Center. Our third resource fair was at Jordan Downs, and our fourth resource fair will be at Gonzague Village. And with each health resource fair, we're able to provide much needed information. We've had patient navigation resources. We've had various of our health service partners out there providing giveaways to the community. So in addition, we've been able to provide, again, like I said, COVID-19 vaccine. And at this time, we've actually been able to vaccinate over 30 people, which we found successful through our health and our health resource fairs, because this actually shows that our town halls and our health resource fairs are very effective in making sure that new first-time people are actually coming to get vaccinated. So we're very excited about this. And we've also provided a lot of social resources, such as various foods are giving out, and as well as raffles. So we are ensuring that the community is well aware. And additionally, we have been promoting even educational opportunities for the youth within the community. So we found that linking this information and with making sure that resources are there for the community is one way of looking to see how can we meet various needs of the community while still emphasizing that COVID-19 is still a huge issue within our community, and to get vaccinated.
With that being said, one, we've had very lively health and resource fairs, and it's just been a great experience seeing the residents in the community out and getting the information that they desperately want in a intimate setting. And we'd like to continue that with residents who have attended the town hall forums and maybe are still hesitant following the forums, as well as the health and resource fairs, about obtaining the vaccine. And so our goal for our phase 3 of this project is to take those residents and recruit them in what we call small group workshops, where they get one-on-one coaching and mentoring with an Activate leader who will consist of or Activate triad, who will consist of our public housing resident leaders, our MPH students, as well as our PA physician assistant students here at CDU. And what they'll do is they'll go through a series of workshops where you can provide coaching, mentoring, linkage to resources. We'll be doing health screenings, which will take place by our PA students. Again, doing social needs assessments. So a lot of these individuals, they may particularly not have gotten the vaccine because their priority are other social issues, whether that be employment, food security, childcare. So making sure we address some of those social impacts that COVID has had on families and residents within the community was key for us in developing these workshops. Additionally, we'll make sure that we address some of the psychosocial as well as cultural impacts or historical impacts of, just medical mistrust in the healthcare system as it relates to communities of color, and how that may impact one's decision to obtain or not obtain the COVID-19 vaccine. So this will be phase 3. And again, we're going to recruit individuals who have already attended the town hall forums and potentially the health and resource fairs, who still remain hesitant or concerned about getting the vaccine, and provide this intimate setting of workshops where they can work with a triad that consists of a public housing resident leader, an MPH student, and a PA student. And our goal is to really just provide wraparound services and support, and making sure that they have all of the information and linkage to services they need to make the decision that's best for them about obtaining the COVID-19 vaccine or not.
And so, even though this project is ongoing at this time, we've known that we've had a large impact on the community thus far, especially with our health resource fairs being at the various public housing sites, working with various governmental and community organizations across the city and even the state. We are doing far-reaching impact with this project, and we know it's because COVID-19 is still here. It's still one of the causes which leads to morbidity and mortality. And we know that it is dire need for our underrepresented communities. So, with this project, we have used an innovative approach, which is to train not only healthcare practitioners, but also public health leaders and as well as residents. As stated before, these are the stakeholders, these are the gatekeepers for our community, so that by training these individuals, we are ensuring that we have sustainability for this project and that it's continuing. Additionally, we are bringing knowledge, resources to the entire community of these public housing areas. And so with that, we are making sure, we're visible. And then lastly, we are still doing one-on-one approaches with this triad to ensure that if you are still hesitant or have concerns about the vaccine, we now have a triad ready to hear, ready to hold, ready to see how can we ensure that COVID-19 information is getting out to you and your family and your loved ones, and how we can increase or reduce hesitancy and concerns for eventually going forward to considering or even getting the COVID-19 vaccine. So this is our approach. And so with that, we want to just acknowledge a lot of influential people who have been fundamentally important and phenomenal to this project. On our CDU side, I want to also thank a lot of our co-collaborators and our faculty. We have Dr. Cynthia Gonzalez, who is part of the Masters of Public Health faculty, who is one of the co-investigators for this project. And she has been fundamentally amazing with helping to make sure. We also have Dr. Roberto Vargas, who has been also very influential in making sure that services are provided, especially with making sure in the community. We have Dr. Cynthia Davis, who's also been helpful. We have Jamil Lacey, who has been part of the TRAP medicine. Additionally, we've had various others, including a lot of our individuals at Kedron Health. We have Dr. Jerry Abraham, Reverend Donisha Beavers, and a lot of other staff who have been phenomenal with making sure that we've had COVID-19 vaccine offered. We also want to recognize Dr. Armand Rogers, who has been with us at our health resource fairs, doing health assessments and screening. And most importantly, I do want to acknowledge our nursing students and other students who have been at every health and resource fair, ensuring that they are there to provide services and assist. And so we also have many others we want to thank, and I will turn it over to Professor Dillard to continue our acknowledgements.
Yes, as you can see, this is a machine that requires a lot of people putting in, their passion and really just their love for the community. And so we'd be remiss if we didn't mention, of course, the Housing Authority of the City of LA, all of their administration staff, their interns who are on the ground, their resident advisory council presidents who have just been instrumental in helping us build that partnership and relationship with the community. So they've been an awesome help to us. Additionally, we've had a number of service providers coming out and providing resources and really just support to the residents during the health and resource fair. So that, again, like Dr. Cobb mentioned, Kedron Health, we've had California Health Medical Reserve Corps come out and provide support by linking us with LA Care Health Plan, who's been coming out doing patient navigation, letting people know of some of the centers and resources that are close within their community, because we have found a number of residents do not have a primary care provider home. And so that's also been important for us to address, along with the vaccine and making sure people are aware. Additionally, we've been working with, again, just a host of individuals and organizations. And again, the list can go on and on. And I do also want to mention Dr. Lucy Kibe for making sure that she's allowed the PA students to be involved, and having their insight has been amazing. But again, a big thank you to everyone, and it's been appreciated.
Okay. And so thank you so much again, as we stated, to all the CDU faculty and staff, and as well as the administration. We're grateful to everyone for their efforts in making this project a success. We also want to thank some of our other organizations such as Coconutville and iHealth Foundation, who's been phenomenal in making sure a lot of our resources have been there. And so with that, again, we are hoping that if you would like to assist in this project or get involved, please reach out to us. And most importantly, we would like to thank the Urban Health Institute for this opportunity and for all of their efforts with ensuring that we are able to make this project a success. So thank you to the Urban Health Institute for always assisting us and for bringing this to a reality.
And before we end, I have to give an amazing shout out to Vaccinate Ya and all of the physicians that you all have provided us in terms of making sure that we have a Spanish-speaking town hall forum. We know that a number of residents are monolingual Spanish speaking, and so making sure that we had healthcare providers, community organizers, residents who speak Spanish and can really speak to them and provide information has been amazing. And we thank you so much for your support.
Thank you. And again, many thanks to our panelists. As you can see, we have a lot of people to thank, but overall, we're just grateful for everyone and their support. So as stated before, if you want to get involved, please feel free to contact us. We are open and ready to get you involved ASAP. Additionally, we would like to thank the Access Center here at CDU campus, which is also known as the Accelerating Excellence in Translational Sciences, which is under the leadership of Dr. Jay Bagama and as well as his team here. We are very thankful for all of their efforts and for the contributions they have made to this project. Additionally, we will also like to thank our CDU administration, including President Carlisle, Provost Michael, as well as SVP Minifield and other leaders on campus. Again, we would like to specifically thank them as all of their efforts has helped in the outcomes of this project. Thank you again for tuning into our project. Have a good one.